Are you getting knee pain? Maybe feeling some fullness in the back of the knee, or maybe you're sort of squatting down and you're not just able to completely bend the knee because it's sort of impacting behind there, then this is the video for you. Today I want to explain why that's happening to you and what you can do or get treated to get that sorted. So Mitch is actually suffering with all of those issues, and we've sort of gone through some testing, and it looks like his popliteus muscle, which is a muscle in the back of his knee, has spasmed up and is creating some change in the mechanics of his knee that we need to correct today. So today we're going to do that with some active release technique and some dry needling. So to begin with, Mitch, let's get you laying face down, and we're going to get into that popliteus muscle. So the popliteus muscle, not many people have actually heard of it, but it's a muscle that goes from here across the knee crease and into the side of the knee here. Its job is to lock and unlock the knee and sort of help stabilize the joint. So to release it, what I'm going to do is I'm creating some stretch through that muscle as we take it through its range of motion. Now this one is not comfortable. Mitch, how are you feeling there?
Yeah, it's not comfortable.
So the main reason I'll see the popliteus muscle sort of jack up, spasm, limit the range of motion through the knee is because the load going through the knee, usually from either above or below, there's something wrong with the stability. So if we're talking above, it's generally glute medius stability. So there's a weakness in that glute med muscle, and the knee will be collapsing, sort of getting that knee valgus as you're doing a squat, running, walking, anything like that. And over time, that force going through the knee, it creates too much tension, the knee freaks out, and you get that spasm through there. So now that we've sort of unlocked that muscle, the two other muscles that sort of come in and around and all the fascial sort of binds into that area, we've got the hamstrings, but then also the calf. So now that I've sort of worked on that a little bit with the soft tissue work, let's get into Mitch's hamstring there. So now talking about that glute medius not working correctly, that's above the knee. The main issue that'll come about below the knee that can cause the popliteus muscle to spasm up is ankle stability. So if you've got a history of rolling the ankle, then that's one that you're going to need to sort of work on. I generally find the glute medius muscle, that'll be probably the primary driver in creating knee pain. It's probably 80% of the time I'll see that as the issue. So things that you can get started on to make sure that the pressure doesn't build up in that popliteus muscle is working through the glutes, loosening them up to start with. So things like a pigeon pose, which is a really common yoga pose, or laying on your back with the figure 4 stretch. They're great ones that you can also sort of just have a quick look on Google. But then once they're sort of loosened up and you've created a bit more range of motion through those, then you want to do things like your glute bridges, your clams, your crab walks, which are awesome just to rebuild that hip control, just to take the pressure out of the knee. Good. So now we've sort of worked on those tissues above the knee. Let's work into Mitch's calf here as well. So there's two major sort of muscles that we'll have to treat in here. One is sort of worked when the knee is bent. That's the soleus. And then when the knee is straight, your gastrocs. So let's start with this soleus muscle. And you definitely need this. That's another pretty brutal one. So Mitch was saying just before we started with this appointment that he was getting pain with his squats quite a lot. We kind of worked out, he's been doing squats for a long time, but he's just started a new program where he's increased the volume and he's doing it 2 days of leg training versus just the one. And that's really been the thing that sort of ticked him over the edge. I think that hip instability's been there a while, but then you double the volume, and that's when things blow out if there's any sort of instability or issue through there. So now let's get into that gastrocs. Good.
What about seated calf raise versus regular calf raise?
Yeah.
Do both?
Definitely do both, because the seated calf raise predominantly hit the soleus muscle. Standing, gastrocs. And so if you want a well-rounded, sort of good defined calf, you need to mix up and do both.
Oh. That one.
It's rough. All right. That's actually feeling a lot nicer as we sort of bend that there. Now that we've created a little bit more space in the knee, what we want to do next is work just through the quad so that it can get back into that range that it's used to, because sometimes that inflammation around that will sort of tense up all that fascia and, you know, create secondary movement changes that'll limit that. So Mitch, let's flip you over. We're going to hit your quad next. You're going to love this.
I'm ticklish.
Sitting up for this one, come to the edge of the table. Oh, still legs that way.
Oh, sorry.
Come to the edge towards me though. Yep. You're going to help me.
All right.
This leg's going to, from here, bend all the way. Then you're going to grab it with that hand and tuck it up. Okay. And Bree, if you want to come around here, you might get a better angle. Hold there. I'm going to hook onto that muscle. That's the one. Good. And that fullness feeling that you were getting in the back of the knee, that's calmed down? Yeah, good.
This is rough.
All right. 3 more passes. Good.
And so why do I often get tightness or instability in one side more than the other?
Could be anything. I mean, sometimes it could be, you know, habits that you have throughout the day. You know, if you have a dominant leg or you've had previous history of injury, like a lot of people, if they've tweaked their back on one side, that will be a big thing that can disengage one side of the hip versus the other.
My right hip always seems to be tighter than my left.
Well, that makes total sense.
Yeah.
So those pigeon pose, that's an awesome place to start. Once you've opened that up a little bit, clams, glute bridges, crab walks, that's the starting place there. And then looking at single leg stability, which we'll look at down the line as well. Perfect. All right, so we've taken off all the pressure with the soft tissue work. Next, dry needling. Mitch, let's go face down. So, same with how we treated the soft tissue through here. We're going to hit the calf, the hamstrings, and then the belly of the popliteus, which is just below the knee crease, because up as we get higher, it thins out where the tendinous attachment is there. So let's start with those.
I love needles, but I'm nervous.
No, you'll be fine. How'd that first one feel?
Yeah, it's all good.
Good.
It's the calf I'm worried about.
Little tiny twitch on that one. The other side as well.
Oh, that went right down to my foot.
Last one coming for that popliteus muscle. Beautiful. Got right on the money. So they've been sitting in for 5 minutes now. So let's pull these out for Mitch. Now, if you've enjoyed what you've seen so far and you've learned something about the popliteus muscle and what affects that, please subscribe and click that link down in the bottom right corner there. That'll help me grow, and I'll be able to get you guys some more information which can sort of help you with your training and things that you can do to prevent injuries as well. But otherwise, we'll see you next time, guys.